I'm Ian Roos and I have cancer. Hence I am what is known as a cancer consumer. I realise that this term is not familiar to some people, but it refers to people who are affected by cancer, either as a patient, a carer, or a family member. I'm also a consumer advocate, in that I get involved with the health system on behalf of others also affected by cancer. In that capacity, I've been part of the team that worked to produce the National Framework for Consumer Involvement in Cancer Control. The framework was developed in order to assist organisations and consumers to have a consistent approach to consumer engagement, to be able to put together what are critical elements to successful involvement of consumers in all the actions taken to reduce the burden of cancer, from prevention through diagnosis and treatment to survivorship and palliative care. The framework is structured around 4 key elements that are essential for consumer involvement in cancer control: committed organisations, inclusive groups, shared focus, and capable consumers. These were derived from information acquired through interviews with over 50 organisations, surveys involving more than 400 individuals, the majority being consumers, and referenced by a group of nearly 20 consumers. It has been informed by consumers, policymakers, health professionals, researchers, and health service managers. The framework is intended for all those involved in the entire spectrum of cancer control, be they consumers, policymakers, health professionals, researchers, or health service managers. Whether they are, for example, in a small rural health service, a major hospital, a research organisation, a cancer charity, or a government department. The framework offers these groups the opportunity to analyse and review what they are doing about consumer involvement, what they need to have in place to ensure that consumer engagement is incorporated successfully into their organisation. It allows people to look at their individual responsibilities and the opportunities open to them in their organisation as individuals. The toolkit is what it implies, a kit of resources that will assist people and organisations to implement the framework. And how can people best make use of this? Well, it is a web-based set of resources for people to explore and use as appropriate. It is not a how-to-do-it instruction manual, as every situation is different. It is a set of resources and aids from which people can choose and use in their unique situation. The website has been specifically structured to offer options to different audiences, including CEOs of cancer organisations or health services, researchers, policymakers, consumers and health professionals working in cancer control. So I would encourage people to explore the toolkit, to use it to assist with obtaining best practice consumer involvement in cancer control.